Thanks for taking the time to view this video blog. Back to the basics of exercise, of movement, the whys. Why should you move? Why should you exercise? We've just come through a series of back to basics, how to do a basic clean detoxification diet, how to go do a basic diet. Most of you really don't understand what the fundamentals, what the essentials of eating are. We just completed that. I'm hoping that you have viewed that as well. As we move forward, the back to basics of movement, the whys, the wherefores, what are the benefits? Should we worship this body? Should we worship this temple? I don't believe that's what we're called to do. I really don't. What I do believe, though, is that we have a responsibility to take care of what we've been given. And taking care of what we've been given assumes responsibility. And I don't want to be blunt, and I don't certainly want to be coarse, but there are many of us that don't know what it is to take a walk through our neighborhood. We are at a desk, we're sedentary the entire day, we are in a vehicle the entire day, or we move around our home a little bit as a housewife and we feel that's getting exercise. It's not. It's really not. We have a population that is becoming more sedentary, more overweight, more cardiovascular disease, more type 2 diabetes. I mean, the list just goes on. Well, I'm not here to thrash you. I'm not here to bash you. I'm here to encourage you and prod you forward. In the next video, I'll give you the fundamentals of hopefully how to be motivated to do so. But today, movement. Why would you want to move? Why is it important? Number one, weight. It helps to control our weight. The more active, the more we expend. This is ABCs. You don't need to really sit here and watch me tell you this, but you need to have this down in your heart, not just in your head. It helps to maintain your weight. Number two, what else can it do? It can help you to manage your cholesterol. Many of us are battling cholesterol issues, high LDLs, elevated triglycerides, low HDLs. Do you know one of the best ways to drop your triglycerides and raise your HDLs is to exercise and move? We'll get into whether it's aerobic, whether it is core exercises, whether it's anaerobic, whether it's resistance. That will come. Today, it's the why, the wherefores, why you need to do it. The other areas, many of us develop, or we're on a pathway to developing what I would term, and what many in healthcare would term as insulin resistance or metabolic syndrome. And what that really means is we're eating a lot of the wrong foods, we are inactive, our insulin receptors are losing sensitivity. Our pancreas, in order to compensate, is punching out more insulin. And more insulin you punch out, that makes you insulin resistant. Here's the downside of that. Type 2 diabetes onset. Increased risk of cardiovascular disease. The issues unfold from there. They're huge. They're humongous. For women, there's issues then with even polycystic ovarian syndromes. Higher rates of breast cancer. Higher rates of ovarian cancer, all associated with insulin resistance. How do you block that process? There's a lot of details, your vitamin D levels and so on, but remember, this is about movement, exercise, and what you consume. Got to move. You must exercise. I will get to the facts about if you have limitations, if you have a bad knee, if you have specific issues, we'll talk about that. We will give you the options. Remember what this is. This is about the principles. Today, why you should, and next, how to be motivated to do so. We've talked about insulin resistance. We've talked about metabolic syndrome, a cascading events that we gain weight. Our blood pressure goes up. We become more fatigued, more tired. We become more dysfunctional in multiple ways. Insulin resistance, metabolic syndrome, developing more visceral fat, weight in through the midsection, in through your hips, in through your abdominal visceral area. Let's move on. What's the next layer of that? The next layer, I believe, is to talk about mood, to talk about depression, to talk about sleep. Exercise is documented to improve your sleep patterns. Significant 30 to 40 minutes of even aerobic, brisk walking, biking, recumbent biking is proven to improve your sleep. So for those of you that have insomnia, moving can improve your sleep. Secondarily, depression and anxiety disorders are minimized the more you move and the more you exercise. We know that our body makes more of the neurotransmitters that produce a sense of calm in our body. That sense of calm is directly related to calming neurotransmitters such as serotonin and gamma-aminobutyric acid, GABA. You can raise and make more serotonin, for example, with exercise and activity because of oxygenation. You need to oxygenate tissues. You need to drive oxygen into the body, into the cells. That makes the reactions go. Literature, and I will back this up in the next presentation, that your anxiety levels can be reduced. Your depressive disorders can be reduced. The Hamilton rating depression scores can be reduced by up to 50% with consistent regular exercise. All of these areas are zeroing in on how you can improve everything from your sleep to your mood to even anxiety and depressive disorders. You can raise your natural endorphin levels and your natural feel-good hormones with more aggressive types of exercise. You'll hear later about a study that talks about how those natural endorphins are actually now documented through exercise to help remodel the heart after a heart attack. That's to come next. Energy. How many of us just need to have more energy? We're tired. We're fatigued. I've talked about it. I've done one of these video blogs. One of the ways that you can improve your overall sense of energy is to exercise and to move. You'll exchange your blood gases better. You'll balance, as mentioned, your stress hormones. You will oxygenate not only your brain and make more brain neurotransmitters, but you will also oxygenate your tissues, your muscles, and improve not only your aerobic capacity, but your sense of well-being. It raises your energy status. Remember, your mitochondria is dependent upon nutrients for energy production, but it is also dependent upon oxygenation. Live whole foods, number one. Number two, improving the oxygenation parameters through exercise, inhalation, exhalation, releasing your carbon dioxide and taking in oxygen. Physical strength. Many of us, and especially as we age, need to be more active because beyond about the age of 35 to 40-ish, we begin to lose muscle mass and lean muscle mass. Along with that, in many cases, we begin to lose bone mass, connective tissue. We find that as folks age, they become more frail. A direct relationship is adequate vitamin D levels, number one. Number two, a key player in this as well, is building that musculature, that connective tissue. This does not mean that you need to become, a bodybuilder, a body, an Arnold Schwarzenegger type. That's not what we're talking about here. But you must move. You must build these connective tissue components. You've got to build strength and ligament and the architecture. Why? So that you're not as frail. So I don't really care if you're 75 and you have not been exercising. There is always a time. You can start in a chair in your home. You can do light bands, small 1, 2, 3 pound dumbbells. You can do stretch exercises, all very, very key with reducing your frailty. What are one of the things that we fear as we age? Our thought process, our cognition, which exercise improves, you'll see, and our physical ability, our ability to be dependent, unfortunately, on others. We want to reduce that ability, and one of the ways is to improve your overall structural strength from your legs up to your hands, your arms, your shoulders, so on and so forth. So what we covered. What does physical activity do? I always say that God built us to move. It doesn't mean God made us to move. God made us to worship Him. But God made us so that we are physical, moving, active beings. We're not meant to be sedentary beings, seated and not moving all the time. Weight can help you with weight. It can help correct many of your metabolic issues, insulin resistance, metabolic syndrome, high blood pressure. You'll see. I have studies for you. The other area is your cholesterol values, dropping your triglycerides, raising your LDLs. Mood, your sense of well-being improves with physical activity. Depression scores go down and anxiety scores are reduced as well. So general mood, or if you suffer from anxiety and depression, they're helped. Your general sense of energy, physical strength, and lastly, the ability to reduce stress. You will reduce your stress levels. Activity and exercise help to reduce stress hormones that are produced, cortisol, adrenaline, noradrenaline. We need to be able to temper these. Fast-paced lifestyles, lots of information being transposed, lots of demand. Children, school, work, education, long hours. Many of you, many of us have our backs to the wall, and we negate exercise and activity. Aerobic exercise, couple of things real quick. Aerobic exercise helps to utilize a thought process where it suppresses, if you will, ghrelin and what's called peptide Y. Peptide Y and ghrelin are suppressed with aerobic activity. What does that mean to you? It reduces your appetite. It drops your appetite. It actually, aerobic meaning like being on a bike, swimming, walking, running, reduces your appetite. Number two, resistance training helps to lower ghrelin significantly. Also a type, that would be weight or machines, a type of an appetite suppressant. We know that resistance training, though, we have to have a blend. Resistance training helps you to burn calories up to 12 hours post the period of activity, whereas aerobic you may only burn for the next 3 to 4 hours. So it's not just about when you do the exercise and the burn of calories then, it's what it does down line. Exercise improves what is called neurogenesis. Documented that as we exercise and as we oxygenate tissue, we actually stimulate new brain cells, the development of new neurons in the brain. This is especially true with children, very, very critical with children. We also know that it improves cerebral blood flow. Documented, these two components have been documented through MRIs. MRIs show that there's improved vascularity and blood flow to the brain the more active an individual and post physical activity and exercise. Dartmouth researchers say that it clears the mind, a direct quote. They say that it has implications for exercise in mental illnesses. They believe that exercise and physical activity for children can be literally a type of antidote to a degree for ADHD disorders. The more a child moves and the more active they are, their ADHD symptoms actually reduce. Suppress your appetite. Burn calories over a longer period of time. Improve new neurons and make new neurons in the brain. Clears the mind. These are just a few of the reasons and rationale why we need to move. And if you're not, I want you to be motivated to do so. Thank you so much for tuning in and viewing this video blog. We have more to come. The next in this series will talk about motivating you. I'll give you some science, and then I'm going to give you some very practical thoughts that hopefully will be taken into your head and into your heart and will motivate you to get moving. Thanks for viewing. God bless you. See you with the next video blog.